Hi, good evening. My name is Kevin Sims. I am the group leader for the group. This is a group being run with individuals who struggle with anger management as well as chemical dependency issues. It is a cognitive behavioral therapy group that runs for 12 sessions and is a closed group format. The ideal number of participants for a group like this is 8. However, 5 to 10 members would suffice. This group is held on a voluntary basis for women who are currently in a chemical dependency outpatient treatment program. These women have had issues in the past with legal as well as problems in interpersonal relationships with family members, friends, and partners because of their chemical dependency issues and anger. Additionally, everyone in this group has a mental health diagnosis on top of everything else. And this is the 5th session, and we are going to be focused on the thought-stopping technique.
My name's Mary. I'm 25 years old, and I started using prescription pain pills when I was 20 and eventually moved to heroin use when I was 22. I'm a victim of domestic violence, and I'm still with the same guy who introduced me to heroin. I talk with my mom, however, we have a rocky relationship because of my use, and I also have not talked to my siblings in a year because of my use.
Hi, I'm Selena. I have a prescription pill addiction. It started in my teens after my parents died. I am 27 and I still live with my older brother who was my guardian after my parents passed. And my relationship with him is very tedious because of my prescription pill use.
My name is Kat. I am also a group member. I have struggled with alcohol use since I was a teenager. My parents divorced when I was 10 because of problems with my dad's alcohol addiction. I was introduced to alcohol when I was 13 and was introduced to marijuana when I was 14 and have continuously used the both of them since then. I'm currently 26. I live with my mother, who is the only family member that I do have contact with at the moment. I dropped out of high school when I was 16 and was living on and off the streets until I moved in with my boyfriend when I was 18.
Thank you. So what I want to do is I just want to start off with introductions. Everybody go around. There's a couple of things that I need to hear. One is going to be your sobriety date. The second is a feeling. How are you feeling today? The third is going to be any anger issues that you've had throughout the week. And lastly, whether or not you need some group time. And I do want to say I appreciate everyone following the group norms and being respectful and honest in the previous 4 groups. So who would like to start tonight?
I'll start. My name's Mary. My clean date is September 24th, 2016. Today I'm feeling very overwhelmed. However, I'm blessed to be here. It's been a great day. I had a situation with my mom this past week, but I think we might have worked through it. So I don't think I'll need any time today.
Thank you. Welcome.
Thank you.
Hi, I'm Selena. My sobriety date is August 17th, 2016. Feeling a little tired today. Over this past week, me and my brother had some words, but I don't think that I need to talk about it right now.
All right. Well, thanks for sharing that. Welcome.
Hi, my name's Kat. My sobriety date is September 30th of this year. I'm feeling a little anxious. I've had kind of a hard past few days with my mom and then also in treatment. I think I might need some time for group at the end.
Sure. Would you like to talk about it now? Go ahead, start it off.
Well, there was this one day at work where I was on an elevator and it was really crowded and I was obviously waiting to get off to the one floor and this person behind me pushed me out of the way to get out, and I got extremely pissed off. And then that just like ruined my entire day.
And how did that make you feel when the person did that?
I felt really disrespected.
Okay. And do you think that the feelings you had were justified? Do you feel that your anger was justified in the moment?
Yeah.
And why do you think that?
Because he pushed me. Like,
Yeah.
he didn't say excuse me. He didn't apologize for pushing me. He just pushed me.
Okay. Can anyone in group relate to feeling that way, having any justified anger? Has anyone been in any situations, whether it be this week or in the past, where somebody has done something to them and they felt that their anger was justified?
Definitely. I mean, as I was saying before, the fight I got into with my mom, I really needed a ride, and she wouldn't even bring me.
Okay.
And I know it's because she's just so mad at me about my drug use. She just doesn't care about me.
And do you think some of it, though, has to do with her trusting you?
I mean, I don't know.
Have there been times in the past where you asked her for a ride somewhere, told her you were going one place, and really you were going somewhere else?
I'm looking back, yeah,
Okay.
definitely happened.
Okay. And I'm not saying that it's not okay to be angry, because this group really what we want to focus on is trying to learn a practice that we can incorporate into our sobriety that can benefit us while we're going through some of these tough times. Because we are going to be emotional. We are going to feel stuff that we haven't felt in a long time, and we are going to go through situations that we don't have any control over. The key for us is going to be, how do we deal with those situations in a way that's going to keep us safe and keep us sober. And one of the thing that I'd like to talk about tonight, and I brought a little gift for everyone, is it's a rubber band. I'm going to give everybody a rubber band.
Thanks.
There you go. And what do you do with this rubber band? So the technique is called thought stopping, and it can really work in any type of situation as long as we have this rubber band on our wrist. It's real simple. It's real basic. But basically, when we get a thought, and this is what I want you to do, is relate it to addiction, anger management. When you get a thought, okay, when you're in the elevator and somebody pushes you, I want you to try to snap the rubber band, okay? And that can say to yourself, don't go there. It can say to yourself, I don't need to be thinking these thoughts. I need to get myself out of this type of situation. And basically, this is just a technique that can assist us from taking it to that next level. Now, when you were in that situation in the elevator, did it escalate for you?
Well, I started to feel like really hot inside.
Okay.
I started to sweat. I think my breathing probably started to, be more shallow, I guess you could say.
Okay. So you felt like panicky?
Yeah.
Okay.
Yeah.
Does anyone else feel those types of things when they get angry? What about you, Selena? When you get angry, what does it feel like?
Feels like hot here.
Okay.
Like I can't breathe sometimes because
Okay.
I'm just so angry
Right.
and
And when was the last time you felt that way?
probably this 2 weeks ago maybe.
Okay. Has anyone in here had any consequences because of their anger?
Yeah.
Yeah. Okay.
Yeah.
And after you had the consequences and you're in the situation, then how did it make you feel? After you were arrested, or after you got kicked out of the house, or
Like a piece of shit.
Really bad.
Yeah.
Yeah.
Like
Yeah.
I was worthless.
Embarrassing.
how can you relate that to your addiction?
I mean, using alcohol all the time and getting into fights with, ex-boyfriends, my mom, my grandma.
And what
You
they
know?
say in recovery is that anger and resentment is the dubious luxury of quote-unquote normal people, right? So for people like us, it can be something that can absolutely, without a doubt, take us down. So it's really something that we need to take a look at. And this technique is not only useful for something that has to do with anger management, can also be useful in addiction as well.